Hello and welcome to today's session of Speaking Week. Today we are focusing specifically on occupational therapy, optometry and radiography. So if you are one of those professions, do let me know in the chat which profession you are joining tonight. We're welcoming every profession, particularly those three. And we love offering Speaking Week to all of our OET professions, and during this week we are holding sessions for everyone. You can see on the screen which profession was covered on which day. Now, if you're looking at that and thinking, oh no, I've missed my session, don't worry about that. All of the sessions were recorded and you can catch up on them as videos through our YouTube or Facebook pages at Official OET. You can find the videos there. And the other thing to say is don't go away if this isn't your session today. Everything that I'm going to talk about, all the tips, all the strategies really apply for every profession. So I'm sure you'll find something really interesting if you stick around and listen in. So in today's session, what we will be doing is to look at a brand new role card for each of those professions. And we'll also listen to some real candidates completing those role cards as part of their practice for OET. And it's going to be an interactive session. I'm going to ask you to comment and share your opinions about the candidates' performance in their role plays. And hopefully at the end, we'll also have a bit of time for Q&A. And my colleague Alex is behind the scenes right now. So if you do have any immediate questions that you want answers before the session gets going, pop those into the chat and she can help you with those. To make sure we're all warmed up and ready to participate, I'm going to ask you a very easy question to get started. I want you to tell me in the chat how many role plays you have to complete during the OET speaking test. Really easy question. I'm going to give you multiple choice options. The answer is either 1 or 2 role plays. So let me know in the chat whether you're joining from Facebook or YouTube. Let me know, do you think the answer is 1 role play or 2 role plays? And I'll check that everyone's awake and ready to participate. And yeah, I can see exactly you are. Lots of 2s coming through on the chat, which is precisely the right answer. You do complete 2 role plays during your speaking test. So we're going to start today's session focusing on occupational therapy. And then after that, we'll move on to optometry and finish up with radiography. But as I said, if that isn't your particular profession, you will still find some really useful content. And towards the end of the session, we have a specific focus on questions. And this is something that across the week we've been picking out and demonstrating that all OET candidates could do with some work on. So that in particular is going to be worth sticking around for. So on the screen now, you can see a brand new role card for occupational therapy. And we're also popping into the chat a link so that you could download your own version of that card. If it's a little bit small for you to see on the screen, the link's now in the chat and you can download that for your own copy. All the cards from this week's Speaking Week sessions will be available early next week. Once all of the live sessions are completed, we'll be adding them to the website as sample test 5. So you will be able to see them there. If you are downloading your own copy from the link that we've just put into chat, do focus just on the candidate card as I'm going to be with you in the session, because that's of course all you can see during your speaking test. The interlocutor card remains hidden so that the conversation is more authentic and unscripted. So thinking about preparing to complete a role play, I want you to let me know what you tend to do in your preparation time. So before each of the role plays in your speaking test, you are given 3 minutes to prepare. You can make notes if you want to, you can read the card more than once, etc. So what do you do to make the most use of your preparation time in those 3 minutes? There's many things you could do. So let me know one or two of those ideas. How do you make best use of that time when you're getting ready to practice a role play? What do you do in those 3 minutes preparation time? Just give you a few more seconds. You might be reading the card and having a good think yourself about some of these preparation ideas. If you want to pop any of them into chat, let me know. Otherwise, we'll keep going and I can share my suggestions for what you should do in the preparation time. All right, so the first thing I'm going to recommend that you do is to check out the setting at the top of the card for your role play. And this is a very small piece of information, but it is quite significant because it tells you how serious or routine the situation is, whether you're talking to the patient or a relative of the patient, and whether they are visiting you in your work setting, whether they're admitted to hospital, or whether, for example, they're in an aged care home. Can even tell you something about the age of the patient. So, for example, if the setting is a children's ward or an aged care home, you've already got some ideas about who it is you're going to be speaking to. You don't need to mention anything about the setting, of course, in your role play, but it does start to help you visualize the conversation that you are about to have. The second thing to focus on, and sorry, I should just point out that for today's card, the occupational therapy card, the setting is a hospital rehabilitation unit. So that tells us obviously straight away that our patient is recovering from some kind of procedure or significant health event. And the likelihood is that the patient is an adult. So now we move on to the background information, and this will always give you details of the patient's age and the healthcare reason for the conversation. But it will never specify the patient's gender or give you the name of the patient. And there is an important reason for this. All OET tasks are written to be genderless, and your patient will simply be the gender of your interlocutor on test day. So if your interlocutor is male, you will speak to your patient as if they are a man. If your interlocutor is female, you will speak to them as if they are a woman. And the background information also specifies whether you are speaking to the patient or perhaps the parent or other relative of the patient. If that is the case, if it says that you're speaking to a relative of the patient, there will also be detail clearly in the background information so that you know that you are not expected to pretend that the child or the patient is also present in the conversation. So, for example, if the background information says you're speaking to the parent of a 6-year-old boy, for example, it would say in the background information, the child is not present for the conversation. So you know you're only needing to speak to the parent. For this card, the background information tells us that the patient is 80 years old and that you are seeing him for assessment prior to discharge, him or her, sorry, and that the patient has had a total knee replacement on their right knee. And finally, you need to spend quite a bit of time, most of your time, in fact, reading through the tasks that are given in a bullet point list on your card. And the purpose of these tasks being given to you is so that you have plenty to talk about in the 5 minutes of your role play. You're not assessed for completing all of the tasks, but the success of your communication, the conversation with the interlocutor. And there are two things from the tasks that you do really need to focus on. The first one is the verbs. These tell you whether you are giving information or gathering information, whether you're providing advice or reassurance, and other sorts of explanations of what you're going to be doing in the tasks. The other thing you want to pay attention to are the brackets. The information that is given in brackets is there to help you, sometimes giving you examples that you can use with the patient or directions of how to complete the task. And the tasks on this card balance gathering information about how the patient is feeling and the patient's living situation with giving information about home adaptations, as well as encouraging the patient about risks they can expect after discharge. A couple of final things that I always recommend candidates do during their role play preparation time is to remember that you can ask the interlocutor to define any words on the card or pronounce any words on the card that you're not sure of, something that might be new for you or you're not 100% sure that you understand. And if you do that, if you ask the interlocutor to pronounce or define any words during that preparation time, it will help you feel more comfortable that you've understood the task and are able to communicate accurately once the role play starts. On this card, I feel like all the words seem pretty routine for an occupational therapist, but of course, if you personally felt there was anything on there that you didn't understand, it's always best to ask during the preparation time. The other question I would ask myself is, thinking now in terms of the patient, are there any words on the card that the patient would be unfamiliar with given the context of the conversation? So, for example, if you had a role play where the patient has just been newly diagnosed with a condition, they're unlikely to be familiar with the medical terminology that goes with that condition, and you might need to explain it to them. So during the preparation time, you would identify any words that you felt the patient wouldn't be familiar with, and then you could think of more suitable lay expressions to use to explain those, or even if you're thinking about just omitting them from the role play because you don't think the patient needs those terms at all. On this card, I think I would say assistive devices is the only one that I would say the patient is probably less familiar with. It's quite a technical expression. And instead of saying assistive devices, you could use those examples given in the brackets. So a walker, a shower chair, and that would probably be clearer for the patient. Lastly, thinking about the timing. So as I said a little bit earlier, there are no marks added for completing all of the tasks, but you are expected to manage the conversation as you would in real life, which means starting the conversation and moving on from topic to topic when you feel it has been sufficiently explored by you and the patient. And it can be helpful to assign, just in your mind, a rough time to complete during your preparation time, so you know which tasks to move through more quickly and which ones are likely to need a little longer to talk through. And there are a number of reasons why some tasks will take longer to complete than others. For example, you might be giving the patient some new information that they're unfamiliar with. You think that the patient is likely to have questions or concerns about what you're just about to tell them. Or the topic could be sensitive, or perhaps the patient feels embarrassed about it. And those topics will generally take a little bit longer to complete more tactfully. So for this card, I would suggest that tasks 1 to 3 are quite straightforward, standard occupational therapy tasks covering information gathering and reassuring. Providing details about the home adaptations and talking through risks after discharge are likely to take more time. So you should aim to keep that early conversation moving fairly quickly to allow sufficient time to explore tasks 4 and 5 and demonstrate to the assessor your ability to handle some of those more challenging tasks. So we recorded role plays with a number of candidates ahead of Speaking Week, so we could use the audio to discuss in these sessions what to do and what to avoid in your speaking test. And we're going to listen to extracts of 2 occupational therapists we recorded to pick out some strengths and weaknesses. So let's listen first to Michael from Australia, and we're going to listen to him starting the role play. And then I want you to answer this question for me in chat. I want you to let me know if you think his opening to the role play was appropriate or inappropriate for this particular card, as you can see it on the screen. So listen to the audio, and then after the audio, I'll ask you to let me know if you thought it was appropriate or inappropriate.
Hello, Rebecca. My name is Michael. I'm the occupational therapist of this ward. How are you today?
Hi, I'm good. I'm glad to be going home today.
Yeah, I'm glad to see you progressing well, and yeah,
Mm-hmm.
I'm happy to have assessment today to see how you are going with all
Mm-hmm.
with all the daily tasks. So for our occupational therapy is like focusing on how you do on your daily task and
Yeah.
how you manage or cope with this task when you're back home. So, can I ask how you're feeling, or do you have any concerns for discharge home?
All right, there you are. Now, even if you're not an occupational therapist, from what you know about OET, you should be able to decide whether you feel that opening was appropriate for starting the role play, as you can see it on the screen, or you feel it was inappropriate. So let me know in the chat what you think about that opening that you just heard from Michael. All right, Jatendra said it was quite good. Abinia is also, it's correct. Gigi, appropriate. Mashaim, also appropriate. So thank you for those. And yes, I would agree with you. I'm going to show you the script of what Michael said on this next screen. And you can see that the opening greeting is cheerful and it's also still appropriately professional. Michael decided to ask the interlocutor what name to use for them during the preparation time. And so he only needed to introduce himself. And he then responded to the patient saying they were glad to be going home in a nice way. His attempt to outline the purpose of the conversation could have been done perhaps a little bit more fluently, but he did finish off with an open question to find out how the patient was feeling about discharge. So my tip here is make the start of your role play as fluent as possible by perhaps writing down the first couple of things you want to say during the preparation time. Because while you might think of that at the start of the preparation time, by the time the 3 minutes is up, you might be looking towards the end of the role card, thinking about some of the other tasks, and you might have forgotten those initial ideas of how you want to start the role play. So if you've got them written down, it will help prevent nerves getting in the way in those opening minutes. All right, now listen to the next section of the role play where the occupational therapist is covering part of task 2. So to find out relevant details about the patient's living situation. And I want you to tell me on a scale of A to C, how accurate you think these questions are. So once you've listened to the audio, you can put A into chat if you think the questions were very accurate, B if they were quite accurate, or C if you thought they were inaccurate, so not very good questions. Okay, so listen to the OT doing this part of the role play, and then let me know A, B, or C in chat.
Yeah, that's good. Yeah. So firstly, who do you live with?
I actually live by myself.
Oh, you live by yourself. Do you have
Mhm.
any family live around you?
No, not very close by, to be honest.
Okay, that's fine. And yeah, and also for your home environment, let's start with the front access. Do you have
Mhm.
any steps for you to go into the house?
Not to go into the house, but there is a set of stairs to my second floor.
Oh, so you live in a double storage house. Do
Yeah.
you know how many steps just roughly?
Um, it's quite a few. I'd say maybe about 12. All right, so having listened to that question and answer session from the occupational therapist and the patient, let me know in the chat if you think that was A, very accurate, B, quite accurate, or C, inaccurate in terms of the questions. We've got a couple of A's coming through, one B and one C. Let's see if we get a couple more answers to get some kind of consensus amongst the group. It looks like mostly B's coming through. Well, let me show you the script. I think perhaps you're being slightly tough on this occupational therapist. I think he did quite a good job of these questions. There are a few small mistakes, but remember your language doesn't have to be absolutely perfect to get a good score in OET. But what I think makes these questions really good examples for you to listen to and notice is the way that the occupational therapist responds to the patient before the next question or echoes some of their answer. He picks up some of the language that the patient says and echoes that into his own answer. And that's a really good way of demonstrating active listening. The other good thing about these questions is that each question is closed rather than a compound or leading question, which quite a few OET professions have difficulty with, and is, as I said, something we're going to look at towards the end of the session. So my tip here is there is always going to be a task or part of a task that requires you to ask questions during the speaking test. So it is something worth spending time on trying to improve. Perhaps try writing out some of your questions in a word processing software, and then look at any suggested corrections that are made to them. There's many ideas of software available online that can check grammar and accuracy of questions. So if it's something you feel you need to work on, make use of that software to check out the accuracy of your questions. Now we're going to listen to the first extract from the second occupational therapist. This one is Ray in Singapore, who's also covering the same task as the one that we just listened to with Michael. The question I want you to answer this time, though, so listening to Ray, if you were the patient, what adjective do you think you would be feeling at the end of what he says? So think about a word to describe how you would be feeling if you were the patient listening to his explanation. It could be a positive adjective, it could be a negative adjective, based on how you think the patient would feel at the end of the audio. Yeah, so you're right. I live in a two-story house, and there's 12 steps up to my house. And I also live on my own.
Okay, so what I feel at this moment, because it's so we go one at a time, maybe for your, because you got a stairs to climb up, and
Yeah.
because it's we just had the surgery very recently. So what I would like you that if you can use a stair crawler, which will, because I understand climbing up with the with the recent surgery, I think will take a while for you to take that, the flights of going upstairs. So maybe if I would recommend you take a stair crawler, and which will allow you to sit on that stair crawler, and you just have to press a button, and you slowly will go up to your second floor, so that you don't get any kind of problem while climbing up with the stairs, because it's just a recent surgery. So
Mm.
for that, I think I recommend stair crawler. And since you mentioned you stay alone at home, some of the things that I would also like to recommend is alarm bell system, so that
Mhm.
in case you had some kind emergency need, or you loses balance, or you fell somewhere, you can press the bell. And it's basically to explain you, the bell is something like, it's like a pull bell. It's got a string, and we can fix those bell at the vulnerable places where there's chances of fall, like in the toilet, maybe
Mhm.
near the door, or in your bedroom. Are you comfortable with that?
Yes, and actually, I already have a personal alarm I wear around my neck, so I think that's going to be fine. All right, so imagine you were the patient. How are you feeling at the end of those explanations from the occupational therapist? We've got Bilal saying confused. Abinaya is also saying it's confusing. All information is at once. Lisa is too much information. Sidra is saying it is good problem solving. Jitendra saying initially I wasn't sure what he's trying to explain exactly. Um, I think that's right. I think you've all sort of hit what I was hoping you were going to say. And I'm going to show you the script of what he is saying. I think the patient would be feeling a bit confused and perhaps even exhausted or overwhelmed. I think Febi has just sent that through. I think that's a good adjective for it. The occupational therapist spends a lot of time talking about a stair crawler. I think that's what he was saying. I'm not even sure myself, because it still ends up being quite a vague idea for the patient about how it might operate or what it might look like. Um, but there's no opportunity to ask for clarification, because the occupational therapist rushes straight into talking about an alarm bell system, which, when the patient does get to speak, they say they already have an alarm. So, my tip here is, after you've given a significant piece of information, like introducing a piece of equipment, check with the patient if what you said was clear, or if they have any response to what you said, before continuing with other information, even if that information is related. I think it's a good idea to try and imagine your communication like a game of tennis. Uh, when you're playing tennis, you hit the ball and it only lasts in the air for so long, like your speech, before it needs to land and your partner needs to send it back to you or needs to reply to you. Don't try and keep the conversation going too long before you allow your partner to reply and send their own response back. All right. Let's listen to one last extract before we move on to optometry. Um, Here, the occupational therapist is completing the final part of task 5, which is to outline next steps. And I want you to let me know, after listening to it, as the last part of the role play, do you think it was a successful conclusion to the conversation? And you can let me know if you think yes, it was successful, no, you don't think it was successful, or not sure. So have a listen and then let me know your opinion. Yes and no. So I already had my house assessed a few years ago, and I did have some rails put in, but I don't really want to make any more changes to the home. I quite like it how it is now.
Maybe for that, what we can do, since you already had those assistive devices at home, maybe what we need to do after you discharge, or maybe after within a week, we fix the appointment to go to your house and do assessment of your house, because the all those accessible items or those handrails that were fixed, where I don't know how long back it is. So at least as an occupational therapy, we, based on your current physical status or physical condition, we can have a better understanding, like whether those handrails are fine enough for you to support, or if they need
Thank
any
you.
kind.
So you heard there the interlocutor ending the conversation with a thank you. That will happen in your own speaking test. Once the 5 minutes for each role play elapses, the interlocutor may even have to interrupt you to stop the role play finishing at the 5-minute mark, so that every candidate is getting the equal opportunity in their test. So what did you think? Was that a successful way to conclude the conversation? We've got some mixed results coming through on chat, a couple of no's, I'm not sure, but also a couple of yeses. Jitendra thought it was well played, but S was thinking the message is getting lost. Now, I certainly think this occupational therapist does have a few communication struggles. And certainly earlier in the conversation, we heard him go quite off topic and have extended turns without involving the patient. But here I felt the occupational therapist did a little bit better. He picks up on some of the patient's cues about the fact that they are comfortable with the current level of home adaptations that they have. And so he relates his explanation of why a house assessment is still a good idea to these concerns, using softening language such as maybe. And you'll also notice that he uses we quite a few times. And that's a really small but effective way of showing respect to your patient and encouraging them to be compliant. Using we instead of you makes it feel more like you're working together as a team rather than you're just telling the patient what they've got to do by themselves. So my tip here is that it's important to pick up how your patient is feeling about your recommendations and explore these feelings if they haven't provided enough detail for you to understand, and then to use these feelings within your next response so that they do feel heard and respected. So overall, if we compare these two occupational therapists that we've heard, Michael's role play, the first occupational therapist, was a bit stronger than Ray's, who was the second occupational therapist. Michael's strengths included the way that he asked questions, he showed empathy, and he involved the patient, but he still had a few areas to work on. There's always some things that could be improved. And that was perhaps the accuracy of his English, which could be a little unclear from grammatical errors at times. On the other hand, the second occupational therapist, Ray, had strengths that he sounded confident and he had a very friendly tone, which would help the patient to relax. His fluency was also a strength, but at the same time, it was a weakness because he did need to break some of those longer turns that he gave with opportunities for the patient to respond or share their feelings about his recommendations. So for both of them, with some work on those weaknesses, they would then be ready to sit their speaking test. We're going to move on to optometry now. And if there are any optometrists listening to the stream, say hi in the chat box now. It would be lovely to know that we've got specifically some optometrists here today, and hopefully finding the new card that I'm about to share particularly useful. For those of you, and I think there are a few of you joining who aren't one of those professions that we're focusing on tonight, I'm sure you're finding that a lot of the content that we're going through has application to your own profession and is useful for understanding the test more clearly. So I'm going to put on the screen now, and we're going to share in the chat the link to the optometry roll card. As before, you can use that link to download the card for yourself, and it will be added to the website at the start of next week after all of these sessions are finished. So let's talk through this card as an example and a reminder of what you should be doing during your 3 minutes preparation time. So first of all, you need to focus on the setting of the card, and it is most common for optometry settings to be an optometry clinic, but it could also be possible for the setting to be in a hospital or an aged care setting, and you should certainly be prepared for both routine and emergency or urgent situations. The second thing to look at is the background information, which is where we look for details about the patient's age and the healthcare reason for the conversation, as well as checking whether we are speaking to the patient themselves or a relative of the patient. And for this card, the background information tells us that you're speaking to a patient who is 42 years old. And importantly, that you have just examined their eyes. This means that you don't need to start with introductions. You can simply start the conversation from task one, and we'll see what that task is in a second. Details about the patient's hyperopia, glasses, and symptoms also are included, as well as your suspicion that they have had an ocular migraine. So looking at the tasks now on the card, as I said, you do need to be careful about checking all of the verbs very carefully. These tell you what you're going to be doing in your communication. Also to pay attention to the information given in brackets, which give you examples of how you can complete the conversation. The tasks on this card show a balance of gathering information by asking questions about the patient's symptoms and giving information about the likely cause of their symptoms and how to manage these symptoms in the future. You'll see that there is quite a lot of bracketed information on this card. So you might want to underline the task words, or if you're taking the test on computer, write down those task verbs during your preparation time so that you don't lose your place and can move on to the next task quite easily. Remember that the information in brackets is often optional, and it's just there to back you up in case you cannot think of what to say during the conversation. And briefly, let's run through those 3 important questions that I think you should all consider, whatever your profession, every time you look at a new role play card. The first one is whether you need to ask the interlocutor for any words to be defined or pronounced for you. I think on this card, they are all pretty routine for an optometrist. But if there is anything that you feel uncomfortable with, it's always best to ask during the preparation time. Then you think about whether there's any medical terms on the card that would be unfamiliar for the patient. And on this card, I think there are a few terms that the patient wouldn't be familiar with. So the names of the further optometry tests that you want the patient to have, as well as hypertension, are things that the patient would probably not be familiar with. And ideally, during your preparation time, you would think of alternative words to describe these to the patient using more lay language, or at least if you're going to use those terms, to explain them clearly for the patient to understand. And the last to ask yourself during the preparation time is how much time should I spend on each task? Which of the tasks that are going to take a little bit longer to complete than others? And here I would suggest that it's tasks 1 to 3, up to the point of giving the diagnosis, that I think will be quite straightforward and you could complete fairly quickly. The second part of the card is likely to be new content and possibly concerning information for the patient. So it would make sense to try to manage your time, moving through those earlier tasks fairly quickly to allow for time for the second part of the card, remembering that there aren't any marks for actually completing everything, but just that you are expected to keep the conversation moving forward from topic to topic. So we recorded one optometry role play with Fung from Australia. And again, like we did with occupational therapy, I'm going to play you the beginning of the role play. And then I want you to let me know whether you think it was appropriate or inappropriate for the card as you can see it on the screen. Sorry, that's a shame. It seems like the audio isn't going to work there for me. So instead, good to know that I've got the script on hand. So let's just flick forward to the script. And you can see here on the screen what the optometrist said. Now, as you can see on the card, as well as with what Fung said at the beginning, unfortunately, she didn't pick up on the fact that the optometrist has just examined the patient's eyes. So these introductions are not necessary. The rest of the opening, though, links well to the card and sounds friendly but professional. So my tip with starting the role play is it's a really small part of your speaking test, but it can determine how well the rest of your role play goes and your confidence about how you are performing. So as I said earlier, I would consider writing down the starting language you want to use during your preparation time and really making sure it matches what's given in the background information so that you start appropriately. Now, hopefully the next audio is going to work. This time the optometrist is completing task 1, which is to find out more about the patient's symptoms. And I want you to listen to the optometrist responding to the patient and tell me in the chat what you think she could have done to improve her responses after each question.
Yeah. So when did you start having the symptoms?
The headache and the vision problems were 2 days ago.
Yeah. And is there any difficulty that that the symptoms are causing you?
My vision has now gone back to normal, but at the time I had a severe headache.
Yeah.
And that was after sort of 20 minutes of flashing lights and trouble focusing on the right side of my vision in my right eye.
Okay, right. So it's the right eye that is worse,
Mhm.
isn't it? So now let's just focus on that right eye. Is there any other symptoms you are experiencing beside the blurriness in the right eye?
No, so it was just really the lack of focus and the flashing lights. All right. How did you feel the candidate did there with her responses to the question? It might be quite hard to have picked up what I thought she wasn't doing so well just from listening to her. So let me bring up the script and I can explain what I think she could have done a little bit better. So you'll notice that the questions themselves are very well phrased and asked, but each time the response that she gives the patient is a version of yeah or yep or okay, right. So especially when the patient said that they'd had 20 minutes of flashing lights and difficulty focusing, an empathy phrase after that to pick up their anxiety. So, for example, to say something like, that must have been worrying, would have certainly improved those responses. So make sure when you are gathering information that you do pick up what the patient has just told you, show some empathy or ask a further question to clarify your understanding and demonstrate that you have been listening. In this next piece of audio, the optometrist is completing task 3, which is to give her findings of the eye examination and likely diagnosis. And I want you to listen and tell me which technique the optometrist is using here. Is she providing structure? Is she giving information? Or is she understanding the patient's perspective? These are all assessment criteria the assessors use to score you. Which of these techniques do you think the optometrist is using here?
Right. So now that I've gathered more information, we're just going to talk about the findings because I've just examined your eye. So your prescription is the correct prescription for you. So it is unlikely that your problem is coming from the prescription. Now, the headaches and the vision problem and also some sensitive to light, they are symptoms of what we call ocular migraine, which is very likely the condition that you are experiencing. So do you have any idea what an ocular migraine is?
It sounds pretty serious. Does it mean there's some permanent damage?
No, it actually doesn't cause any permanent damage to your eye. And yes, it does sound quite serious. I'm just going to explain to you what it is. So it's just a restriction of blood flowing to your eye. It can cause some sudden narrowing of the blood supply, so that can cause the vision to be blurry and also headaches and flashing light as well. Right. Is that clear for you?
Yeah. Yeah, I understand that. Yeah. All right, so let me know which technique you think the candidate was using in that bit of audio. And I'll just mention, I can see a couple of questions have come through, which I've starred, and I'll answer once we come to the end of the session. We'll have some time for Q&A at the end. So thanks for the question, SM. I will come back to that a little bit later. The responses coming through are information giving or understanding the patient's perspective, mostly information giving coming through. In fact, this was, I'd say, a little bit of a trick question because I think the optometrist was doing all of those things in these responses. She starts off by explaining where the conversation is going next. So we're going to talk about the findings. after giving the diagnosis, she checks if the patient has any prior knowledge about it, which is part of information giving. And then she picks up the patient's cue that the diagnosis has caused anxiety and provides some reassurance about that, which is responding to the patient's perspective. So my tip here is don't just treat the assessment criteria as individual items that you can attempt to tick off one by one. Successful communication will actually cover a number of the assessment descriptors in the same piece of speech. And this was a good example about how you can evidence more than one thing to the assessor at any one time. We're going to listen to one final extract from the Optometrist, and here she's covering some of tasks 4 and 5, which are to explore the relevance of the common triggers to the patient and make recommendations for management. And here I want you to think about the optometrist's speed of speech, and let me know if you think she's speaking too fast, just right, so at a good speed, or too slow.
All right. And how's your general health? Do you have any existing health problem?
I don't. I know that
Okay.
I don't drink enough water, and if I'm
Okay.
really busy, I sometimes skip meals, and I know that's not particularly healthy, but I don't have any conditions.
Okay, right. So you mentioned you skip meals sometime, which can cause low blood sugar level, and that can trigger the ocular migraine. Also, not drinking enough water can leave you dehydrated, and that would be another trigger too. So now that we've talked about what could have triggered it, there are things that we can do to prevent it from happening again in the future. So one of it would be drinking more water. Another thing would be being less stressful at work or trying to manage your stress at work. And if that doesn't help with the headaches and the blurry vision, you can take painkillers for the headache and also taking regular rest. Okay.
All right, so how did you find the candidate's speed of speech there? Was it too fast? Was it just right? Was it too slow? Most of you are saying just about right. Yeah, let's have a look at the script. I think the optometrist was doing okay with her speed of speech. What I would say is what was happening, this was towards the end of the role play, and I feel like she was speaking a little bit more fast, particularly at the beginning of that second response where she's talking about skipping meals, which can cause low blood sugar level. And you can see it's quite a long response. So she's not involving the patient. She's just going through a list of items. So the tip that I would give you here is make sure that you keep your speed of speech measured. And even if you're speaking at a good speed of speech, don't abandon the good things that you've been evidencing earlier in the conversation, such as involving the patient in an attempt to complete all of the cards. So there is a tendency from some candidates to speed up at the end to try and cover the last few bits of the card, which isn't necessary. As I said before, you're not given additional marks for completing all of the tasks. So overall, Fung completed the role play confidently, and she structured it well and incorporated the patient's perspective in her responses. A few of those responses lacked empathy, and her introduction wasn't quite right for this specific role card, but these are quite little things. And I'm really thrilled to say that Fung contacted us recently to say that she had got 4B grades for OET, which are the scores that she needs for registration here in Australia. So that was some really good news. All right, we are moving into the last of our professions for today's session, and that is radiography. So if you are a very patient radiographer who's been waiting for your turn in the spotlight, do let me know in the chat that you're here and listening. It'd be lovely to know that you're online. And I hope the rest of you will continue listening just for this last section, because then we'll move into a focus on asking accurate questions, open and closed questions, avoiding compound and leading questions. So that will be coming up in about 10 minutes time. So do hang on for that. And I'll also answer some of those questions that have been coming through in the chat more recently. So on the screen now is the new card for radiography, and it's also coming into the chat now as well for you to download your own version. As with the other cards, let's talk through this card as an example of how to make use of your preparation time. So the setting of the card is to make sure you understand where the conversation is taking place. Now, for radiographers, it is most common for radiography settings to be in a hospital radiography location, as is the one for this card. But you should also be prepared for both routine and urgent scenarios. So it could be the emergency department, or it might mention emergency in the background information. Speaking of the background information, again, here we look for details of the patient's age and the healthcare reason for the conversation, as well as whether we are speaking to the patient themselves or a relative of the patient. And for this card in particular, we can see that our patient is 67 years old and that they need a chest X-ray to screen for tuberculosis. And more details about the patient's health are given in that he or she has a pacemaker. But there's nothing in this background information that suggests you've met this patient before. That's pretty standard for radiography cards. Usually you won't have met the patient before. So introductions are generally going to be appropriate for your tasks. Finally, we can look at the tasks as a bullet point list, and remember that you want to look carefully at the verbs starting each task, which explain the communication you will have in each part of the card, as well as the bracketed information which is there to assist you. The tasks on this card for radiography show a balance of gathering information by asking questions about the patient's anxiety to have the X-ray and giving information about the safety and process of the X-ray. Remember, there is a lot of bracketed information, but you don't have to include it. It's there to help you keep talking for the 5 minutes, and if you forget what it is that you want to say. Going through the 3 questions quite quickly, I think all of the words on the card are routine vocabulary for radiographers. And in terms of any language that the patient might not be familiar with, I think the only term is electromagnetic waves. So you would ideally think of another way of explaining that to the patient, or just omitting that term completely. And in terms of timing for these cards, I think the middle of the card, the tasks 3 and 4 are going to be the ones that take the most time, because we can see that the patient is quite anxious about the impact of the X-ray on their pacemaker. In contrast, tasks 1, 2, and 5 are quite straightforward. So it would make sense to try and manage your time to move through those first 2 tasks quite quickly, to allow yourself more time to spend in the middle of the card, and just keeping task 5 at the back of your mind if you have time to get there, because remembering you don't have to complete all of the tasks in the time. So as one last example, we're going to listen to a radiographer from Australia called Tram and listen to her starting the role play and then answering the same question that we've asked for the other professions. Was this opening appropriate?
Rebecca, is it? Yeah.
Yes, that's right.
Yeah, my name is Chum. I'm a radiographer. I will be helping you with X-ray your chest today. So how do we feel about having this chest X-ray today?
There we are. It's quite short, but how did you feel the radiographer did there in terms of whether that was an appropriate way to start this roll card? Let me know in the chat if you thought this was appropriate or not, regardless of whether you are a radiographer. This applies to all the professions. Thinking about the context, the background information, do you feel what the candidate said was suitable for this card or not? So Lisa is suggesting she thinks it was appropriate, as does Marco. And I would agree with both of you. I think this was an appropriate way to start the role play. If we look at the script of what she says, introductions are made and done in a very friendly approach to find out how the patient is feeling about the X-ray. Perhaps to improve this even further, she could have included that the purpose of the X-ray is to screen for tuberculosis, but probably that would be the only amendment I could recommend. I thought this was a pretty strong introduction. So as a tip here, if it's more natural for your healthcare role, ask the patient's name during the preparation time so you can use it in greeting before introducing yourself, as Tram did here. That's perfectly all right to ask the interlocutor for their name in the preparation time so that you can use it at the start of the role play. Let's listen now to how the patient replies to this question and then what the radiographer says in response. And do you think if you were in the patient's shoes, you would feel more comfortable about having the X-ray after the radiographer has finished speaking? So let me know if you think you would, yes, feel more comfortable, not more comfortable, or you're just not sure. You can't tell if this was a good or a bad example. I'm feeling fine, but just a little bit anxious about the chest X-ray.
Yes. Yeah, I can understand. Most patients come here for the X-ray. They always a bit anxious or want to know why, and I think this is understandable. And so, have you had any experience with X-ray before, Rebecca?
I have had a few X-rays in the past, and my main worry is because I have a pacemaker. I'm worried that the X-ray is going to affect how it will function. Okay.
Yes. So, if you have experience with the X-ray before, and yeah, I can reassure you that X-ray does have no effect on pacemaker. Yeah, unlike MRI, where they use magnet, where it's kind of like an effect. Strong magnet have an effect on pacemaker. So maybe in that case, you might be, maybe you should be worried and maybe you not be able to have an MRI scan. But this is X-ray. So normally X-ray just use the ionizing radiation and collect the send signal, and then the computer generate images, and so we be able to see it on the X-ray. And X-rays had no effect on that. So do you feel a bit better?
All right. What did you think to how the patient would feel having listened to the radiographer's explanation about the X-ray? Do you think you would feel more comfortable? So yes. Not more comfortable, so that would be a no, or you're not sure, you couldn't really tell. Great. So we've got a couple of people coming through saying yes, you would feel more comfortable. We've also got a no. It gives information, but perhaps doesn't fulfill the concerns. I would suggest the patient would be feeling more comfortable having listened to the radiographer's explanation. I think they would feel that their anxieties about any impact on their pacemaker had been addressed. And the radiographer does this in a couple of ways. So first of all, she picks up the patient's concerns about and normalizes it by saying that this is something a lot of people worry about. And then she finds out if the patient has prior experience of X-ray and links this to her next explanation as a way of providing reassurance. And what I think she's doing quite well is she's using the card, picking out pieces of information from the brackets to respond appropriately to what the patient has actually said. So, for example, she asks about previous experience instead of radiation, which is actually on the card. So she chooses to say, have you had any previous experience, which would be a more familiar word to the patient. It does get slightly complicated towards the end of that second response, where she starts talking about magnets and the computer images. But I think overall, the patient would feel that her concerns have been understood and addressed. So my tip here is that the card contains all the information you need to communicate and respond to the patient. And you can use that to make it as personalized as it needs to be. If you've used your preparation time wisely, you should then be able to be flexible with the card, like the radiographer was here, to make your conversation as meaningful as possible for the patient. Listen to this next short extract as the radiographer changes topic. So changing topic is evidence of providing structure, one of the clinical communication criteria. And I want you to let me know in the chat if there's anything you would change about what the radiographer says here. So it is quite short. You'll need to listen carefully. Is there anything you would change?
Anyway, yeah. So anyway, you have any other like symptoms? Do I need to know?
No, it's just the pacemaker. All right, as I said, that was pretty short. Anything that you heard that you didn't think was particularly appropriate as a way of changing topic that you would avoid if you were doing this task yourself? Perhaps move on to the script, and some of you may be coming through with your comments. The words that I was hoping you were going to pick out were these uses of anyway. She uses anyway twice, and certainly it is a means of changing topic. We do it quite a lot when we're speaking, but perhaps it's not suitably professional enough for changing topic with a patient. Remember, it is important that you keep your language choices and tone appropriate for the setting that you are speaking in, because those are covered in the linguistic criteria. So my tip here is that the tone of the role play should be professional but friendly, but not informal. So if you know you have a tendency to use informal linking words or phrases when you're speaking English every day with friends or family, this will be something that you need to work on and try to omit from your speaking test so that it doesn't impact your score for appropriateness of language. So we've got one final extract from the radiographer as she completes the first part of task 5, which is to explain positioning for the X-ray. I want you to listen to her completing this task and then let me know on a scale of 1 to 3 how you would rate it. So you would give it a 1 if you thought she did this very well, it was very good, a 3 if you thought it was not very good, and 2 if you thought it was just okay.
Okay, sure. With this, if you have X-ray before, you might like recall a bit about, so about the the positioning. I mean, do you remember that you have to stand in front of some sort of imaging plate where you had to stand, and then how you should hold a couple of positions for me to take X-ray. So it could be So do you remember about that at all?
Yes, that's coming back to me. Yes.
Yeah. So, but I think the thing you be able to standing for a little bit, standing in front of, you can stand. So you need to hold you can face in toward me and face, or maybe face in the radio, the imaging plate. But that's not a problem. But are you able to hold your breath a bit, for maybe 5 seconds or something?
Yes, I think so.
Yeah. So let me show you where the machine is, just here. Yeah, you can see that there. Yeah. And but with this procedure, before I start, I actually need you to ask you a few questions.
All right. So what did you think? The task was to explain the patient positioning. Do you think she did that? 1, very good, 2, okay, or 3, not very good? All right, we've got some different opinions. Was okay, very good, speaks very fast, didn't explain well. So a few different options. Let's have a look at the script and I'll give you some suggestions. So I think this task was done okay. The patient would have been able to follow the radiographer's explanation, but given that this should be really familiar content to the radiographer, for example, how the patient needs to be positioned for an X-ray, it would really be expected that the explanation could be delivered more fluently and with less hesitation, and also without the abrupt change of direction to questioning that comes at the end. Potentially, the radiographer is relying more on the card at this point and reading from it rather than using it as a prompt. And that's why she suddenly moves from talking about the machine to needing to ask more questions. So my tip here, my final tip, is that certain routine aspects of your role may regularly form part of role cards. So these are things that you can practice during your preparation to deliver fluently and confidently. So I think for radiographers, how to stand or to lie or to be positioned for the different tests that radiographers complete are pretty standard types of tasks you may complete in your role card. So practice giving those explanations so that you can do them regularly and fluently. But overall, Tram would need to do a little bit more work before she would be ready for her speaking test. She already has some strengths in the confidence she had at the beginning of the role play, showing empathy to the patient and being able to explain to the patient in a way that is reassuring. But she needs that confidence to continue throughout the role play and work on her overall fluency to reduce the amount of hesitation in her responses. Her pronunciation was also a little unclear at times. She did try to articulate the sounds as clearly as possible, so it wasn't having too much of an impact on the patient's understanding, but pronunciation is still something that she could also work on. So we've now looked at 4 samples of occupational therapists, optometrists, and radiographers completing a role play, and some strengths and weaknesses among all of them. And as I've said throughout the session, a common weakness for all OET professions in general is accurate questioning techniques. And a successful healthcare consultation will always have a typical structure of starting with an open question and then moving into closed questions. And OET role cards will have at least one task where you will need to demonstrate questioning. So it is important to work on this. And just for the last part of this session, we're going to look at some examples of successful and unsuccessful questions for these role plays that we've looked at. So first of all, let me just turn off my camera. I'm showing you 4 questions on the screen. 3 of them are successful, open questions, and 1 of them is unsuccessful. I wonder if you can identify which one is the unsuccessful open question. 1, 2, 3, or 4. Which one is unsuccessful? All right, have a look, see if you matched the answer I've got on the screen. So it was number 2. And this question on the screen, number 2, is actually a closed question. It's not asking the patient to explain in their own words. It's just a statement, really. It's closed. And there are a couple of corrections needed to make number 3 correct. So we would say living situation rather than house in that question. To make that question on the left work as an open question, we could just change it to, can you tell me more about your symptoms? Here are some examples of successful closed questions that were asked by our candidates in the role plays that you've been listening to. I've just added a few corrections that are needed, just the one in that middle question, so that we've got the correct language. But these are all examples of successful closed questions. Now, in information gathering, which is one of the descriptors, you are told to avoid compound or leading questions. And I've got one example of each of those here. One of them is compound and the other one is leading. And I'll show you which way round they are on the screen now. So the first one is a compound question. And compound questions ask patients more than one question at a time. We can see it saying, can you describe it? Is it a pain? Is it a tension? Is it a discomfort? And it's confusing for the patient to know how to answer that question, which words to use, because so many questions have been asked all at once. And the second question is what we call a leading question. And leading questions put ideas into the patient's mind that they perhaps wouldn't have thought of otherwise. So it's suggesting that the patient may have had the pain the day before or the night before, and it might make the patient feel a little bit uncomfortable that perhaps the doctor, or in this case, I think it was the physiotherapist, was asking, the occupational therapist was asking, was the pain severe enough for coming in today? If it only started this morning, perhaps they should have waited longer before coming in for their appointment. So that's the problem with leading questions. And we can make these questions work successfully as closed questions. So the first one could just be, can you describe the pain? And the second question would just be, when did the pain first start? And then they are both very successful questions. So this is something we will be spending more time on, offering more content on, because I feel questions are something that candidates all need to work on and can learn from, went forward too fast there, can learn from and improve on. All right, so we are almost at the end of the session. I'd love you to let me know in the in the chat whether you have learned something particularly useful from today's session. And while you're doing that, I'm going to answer a couple of questions that came through during the session. And then we'll wrap it up for today. So do let me know in the chat if you found anything particularly useful from today's session. Now, there are a couple of questions that came through earlier. The first one was from SM, who's saying, does it impact the score negatively if we repeat a phrase that is written on the card? The answer to that is no. The information given to you on the card is there to help you with your communication. You can use that language. Some of the considerations that I would have for using the same language on the card is just to make sure it's appropriate for the patient, that it would be clear for them to understand. If it is, it's absolutely fine for you to use it. And of course, you'll add your own language, your own explanation around those words on the card, which are really there to act as prompts. And this other question coming through on YouTube is, what exactly does providing structure mean? So providing structure is one of the assessment criteria, one of the clinical communication criteria, and providing structure is evidenced in a number of ways. It means things like sequencing the interview, using language like, first I want to do this, next I want to do this, finally I'm going to do this. That's an example of showing sequencing. Also to signpost changes in topics, so things like saying, I'd now like to ask you some questions, is signposting that you're changing direction, or before I ask you about this, can you tell me about that? That would be another way of signposting. And also using organizing techniques in your explanations. So those are some examples of how you provide structure. So thank you. I'm really glad that you found the session useful. We will be sharing the roll cards from all of these sessions, as I've mentioned, at the start of next week. And in the meantime, I'm going to add to the chat now the speaking assessment criteria. If you want to know more about what providing structure means, then certainly you can find it from this link. You'll find more details about all of the assessment criteria, which you can see on your screen right now. So do make sure, if you haven't already done that, that you bookmark that page, you download or you print off your own copy, so that when you try out this role play yourself and you record the conversation, you can then listen to your speaking and reflect on your strengths and weaknesses against the criteria, the assessment criteria that the assessors are using to score your speaking. All right, we have one more session tomorrow, which is covering physiotherapy, speech pathology, and veterinary science. So perhaps I might see you at that session. Otherwise, thank you so much for joining me today. I'll see you again soon. Bye for now.